I mean, I see faculty as patients too, which I think not a lot of people have that perspective where they're seeing the student side and seeing the faculty side. And faculty, one, have really struggled over COVID too. And I think it's important to point that out and say that this hasn't been easy for them either. They've had their own transitions. They've had to teach classes online when they've never had to do that before. And I think actually saying that out loud to students is what matters, because if you just pretend this has been awesome for you and they're the ones struggling, then they feel alone, but you're human too. So having those conversations makes students feel like they can talk to you about things. It might not be the first thing they ever talk to you about, but I think it's really important to open that door into saying, like, I'm a person you can come to for this stuff. I don't like to pretend that life is amazing and this has been awesome all the time, that I have struggles too. I think that that's a really good way that faculty can help. Also, having an awareness of like signs and symptoms of depression and anxiety and substance use and some other things can be quite helpful as well, because they are often the first people that see any of this, besides friends, because they're in class. Maybe their class behaviors change. Maybe the way that they're writing a paper or turning in things change. Maybe they stop coming to class. All of those things that you might notice as a faculty member that like I wouldn't have any idea of knowing, because I don't have access to someone unless I had access to them from the faculty member with consent, right? So I think it's important that faculty have that awareness, know how to communicate about it, and know what the resources are in campus, out of campus, to get people help, because they're not the people who should be holding that burden. And I think that can feel really hard as a faculty member. You're not a mental health professional, you're not trained to be doing this as your job, but you interact with it a lot. So you need to basically know how to screen, hold it, get people to the right place, and not take it like all on yourself.